I think today the topic we're going to really discuss is kind of bladder cancer. And I know you're really well versed in this area, but I really want to kind of step back kind of from a more global perspective here. Non-muscle invasive bladder cancer, which is really the thing that I think is personally more exciting over the last few years, because there's so much progress that's made in this area. The field is it's changing. It's ever evolving. I'd say 10, 15 years ago, I think you'll agree, BCG was a mainstay, and in most regards, it still is the mainstay for treatment for non-muscle invasive bladder cancer. But there's a lot more options in terms of intravesical therapies, some for BCG naive settings, some for not. But kind of give us kind of a broader perspective of when a patient comes in that's newly diagnosed, that is non-muscle invasive, has non-muscle invasive bladder cancer. How do you kind of approach that problem, and what agents do you typically use in your practice?
Yeah, absolutely. That's a great question. Very dynamic field, so there's a lot to talk about.
Yeah,
And you outlined it beautifully. For the longest time, BCG has really been the mainstay of what we've been using.
yeah,
It was first trialed in the bladder in 1976. The thought was that, an immunologic agent could help bring in immune cells and an immune response to help, your own body to keep the cancer from coming back. BCG is actually the original immunotherapy for any cancer, let alone
that's
just
right.
cancer, which is pretty
That's
cool.
right.
Um, so it's been around for a long time. Urologists are very familiar with using it. I'd say about, 15 to 20 years ago, there was a series of randomized controlled trials, mostly done in Europe, that compared single agent intravesical chemotherapy versus BCG. And obviously, when you have so many studies, there's more than 30 of them, you're going to find mixed results. But for the most part, systematic reviews have shown that BCG outperforms all single agent chemotherapies, especially when you're including BCG maintenance along with BCG, because that's able to maintain the immune response. Fast forward to 2012, um, at least all the urologists in the audience are going to be very well versed with the fact that there's been a BCG shortage. We went from
Yeah,
two suppliers of BCG down to one. Patients and doctors were stuck between a rock and a hard place. We know we have alternatives to BCG, but they don't work quite as well. What are we going to do? At the University of Iowa, Mike O'Donnell came up with sequential chemotherapy regimens with the rationale that for systemic cancers, we often give multi-agent chemotherapy. Why are we only trying to give one agent inside the bladder? Doce, sequential intravesical gemcitabine followed by docetaxel had some very promising data in the first line setting, especially during BCG shortage. Right now, we're in the middle of a very popular randomized controlled trial called Bridge, which is randomizing patients to BCG or gemdoce. And I think your center is accruing a ton of patients to that study as well.
yes.
So we're really excited to see that result. That's one of the major kind of breakthroughs in the BCG naive space as an alternative to BCG. And then I think you're going to probably ask about some of the newer trials in this space. And we have some really promising data about new combination regimens as well.
Yeah, I mean, I think you really set the stage perfectly there. BCG was the mainstay, and has been the mainstay, and kind of, the last few years, like you said, 2012, gemcitabine, docetaxel, so sequential chemotherapy has really become a more popular option, and we haven't quite validated in a phase three setting, except for, I think Max Cates over at Johns Hopkins is a principal investigator for the Bridge trial, and that's, through ECOG, and that's going to be really exciting to see in a BCG naive setting. How do those patients respond better to BCG or to gemcitabine docetaxel? Short, we kind of tend to call it gemdoce. So I totally agree. I think that's a really exciting aspect of some of the data that's going to come out.